So I think what excites me most about PACE, and again, as the acronym of prioritizing to address our changing environment, is that it recognizes that it's the one, in terms of change, it's the one constant in our universe that we all know that you very much have to be prepared for and anticipate change. And so I think that as we, as a department now, embrace this idea, this framework of PACE, that it puts us in a situation where we both can anticipate and be much more proactive in terms of how we oversee this network of over 200 providers, and then how we actually respond to the community more broadly. We envision a Philadelphia where every individual can achieve health, well-being, and self-determination.
We are the keeper of the ideas, the concepts that drive our department and, to evolve. And part of that evolution is that, we bring all of the aspects, all of the components of the department together, and planning innovation becomes a key cog in that wheel. The biggest challenge that PACE will help to address, I think it's the challenge of alignment, coordination, and integration. A department that has 3 distinct cultural components to it now is looking to move towards a population health approach. We have to support coordination across all the departments, and ultimately, wherever possible, we need to begin to integrate in order to, build a more secure, healthcare economic approach.
So the Behavioral Health Division is a key support to a number of providers in the system, approximately 60 plus. And we do that with a staff of approximately, depending on the units, somewhere between 150 and 200 staff. Everything from contracts and budget monitoring all the way through client-specific supports. I think the word PACE for me at the onset when I was trying to grab a hold of the acronym, I think where I spent some time was just really hearing the word and putting it in a context of how you think of like a pace car or that person that's first in a relay race. They set a pace, and it's a consistent pace, and it's one that allows people to get a tempo, and it allows people to get into a groove. And I think that for so long I have felt like we've been in a sprint, that to have a process that's going to allow us to get into a pace and to get into a groove with what we're doing and improving every day on that. Probably the best way to put it is that PACE is going to lend a structure to our work in a different kind of way than we've been functioning. It will allow us to look at everything from someone coming into a service, engagement, very early outreach, all the way through all of the creative work that we do, new services, new ways of accessing things for both providers and for individuals in the service.
The IDS division administers 2 state-funded programs, services for individuals with an intellectual disability, as well as the infantile early intervention program. And so our role is to make sure that Philadelphians who have need of those services actually have a chance to access them. Well, what I want IDS staff to know about PACE is that it is a framework. But we are the experts in terms of delivering the services to the ID population as well as to the infantile early intervention population. So we are challenged then to take our work and see how it fits into each of the PACE areas. I think it does fit, and I think that they will find when they look at it more carefully that it's an easy fit for the work that we do on a day-to-day basis. But I think it is going to take some work on their part to really unpeel it and piece by piece look at it and figure out how it does connect back to the work that they do each day. So one of the things that excites us the most about PACE is the innovation part of it, because we recognize that in light of dwindling resources and funding, that we have to be very innovative in how we are able to get services to the people who need it.
So Community Behavioral Health is an innovative program. We are a 501c3, which is a not-for-profit. We currently have over 400 staff, and we administer the Health Choices Behavioral Health Medicaid program on behalf of the City of Philadelphia. Community Behavioral Health is really going to be a key partner. We believe in being able to fulfill the obligations that have been set forth in our PACE and strategic planning. We have tremendous challenges in Philadelphia. We're in the midst of an opioid crisis. We have lots of children's service needs. We really serve from birth to death, from early childhood to the elderly, and have an obligation to really work with our partners in a different way so that we can maximize our programming and our financial commitment to really make a significant difference for our community. I believe that our PACE opportunity is really significant. What I'm excited about is the fact that we will work differently and prioritize actions that need to be taken. We at times, I believe, have 1,000 things that are all important. I think this will be able to streamline, make it really essential for us to focus and make a difference. Also have quality metrics and ways to gauge our progress.
Division of Administration and Finance has the overarching responsibility to support all the other divisions within DBHIDS. Taking a health economics approach, the focus is on quality, values, and outcomes. One of the things that makes DBHIDS so effective is the multiple divisions that make up the department. There are 6 divisions, and all work together to achieve the ultimate. We all serve the same purpose. The purpose is to serve Philadelphians. We all have the same job, which is to ensure that Philadelphia has the best services available for those with behavioral health challenges. As such, the Division of Administration and Finance has responsibility to help provide information through data, through finance, through communication. I'm very excited that we now have PACE, that we have a strategic framework that can help guide us. The work that we do is complex. It's not easy work. This is work that needs the kind of organization and the tools that a strategic framework such as PACE provides us.
We are really fortunate. One of the things that I've said on many occasions is the staff that make up the Department of Behavioral Health and Intellectual Disability Services are among the most talented, compassionate, committed people that I've ever been fortunate enough to work with. And I think that where we use, again, this term PACE, and particularly kind of the CE, the changing environment, I think it parallels kind of their processes. Their daily work will change. It will continue to change. It will continue to evolve. And so as we use this acronym, what I want them to understand is 2 things. One, how much I appreciate their willingness to continue to change and embrace change. And then secondly, how they are committed to serving kind of the changing nature of Philadelphians.